Hello, everyone, and welcome back to Nurse Quiz Corner, your go-to place for nursing exam prep. So, in today's video, we are diving into some essential CNA practice questions that will help you sharpen your skills and ace your exams. Without further ado, let's get started.
1. When lifting a heavy object from the floor, you should A. Bend at the waist. B. Bend your knees and lift with your legs. C. Keep your knees straight. D. Use only your back muscles. Answer B. Rationale. Bending the knees and using leg muscles helps prevent back injury. 2. Which of the following is the best way to prevent the spread of infection? A. Wearing glove. B. Using hand sanitizer. C. Washing hands frequently. D. Wearing a mask. Answer C. Rationale. Frequent hand washing is the most effective way to prevent the spread of infection. 3. How often should you reposition a bedridden patient? A. Every 8 hours. B. Every 6 hours. C. Every 4 hours. D. Every 2 hours. Answer D. Rationale. Repositioning every 2 hours helps prevent pressure sores. For the term perineal care refers to cleaning the A. Hands and feet. B. Mouth and nose. C. Genital and anal areas. D. Face and neck. Answer C. Rationale. Perineal care is essential for hygiene and preventing infection in the genital and anal areas. 5. When assisting a patient with feeding, the CNA should A. Feed the patient quickly. B. Offer large bites. C. Alternate solids and liquids. D. Feed the patient lying flat. Answer C. Rationale. Alternating food and drink helps with swallowing and digestion. 6. The abbreviation BID on a medication order means A. 3 times a day. B. Every other day. C. Twice a day. D. 4 times a day. Answer C. Rationale. BID means twice a day from the Latin bis in die. 7. Which is the best way to identify a patient? A. Check their wristband. B. Ask them their name only. C. Look at their bed number. D. Call out their name. Answer A. Rationale. Wristbands provide accurate identification for patients. 8. The most common site to measure pulse in an emergency is A. Radial pulse. B. Carotid pulse. C. Brachial pulse. D. Apical pulse. Answer B. Rationale. The carotid pulse is easily accessible and strong in emergencies. 9. What is the normal range for an adult's respiratory rate? A. 8 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 28 breaths per minute. D. 30 to 40 breaths per minute. Answer B. Rationale. The normal respiratory rate for adults is 12 to 20 breaths per minute. 10. What should a CNA do if a patient begins to fall? A. Hold them up forcefully. B. Gently guide them to the floor. C. Step aside to avoid injury. D. Yell for help immediately. Answer B. Rationale. Guiding a patient safely to the floor reduces the risk of injury. 11. A CNA notices red, swollen areas on a patient's skin. This may indicate A. An allergic reaction. B. The start of pressure ulcers. C. Poor circulation. D. Skin dehydration. Answer B. Rationale. Red, swollen areas can be early signs of pressure ulcers. 12. When measuring blood pressure, which artery is usually used? A. Radial artery. B. Carotid artery. C. Brachial artery. D. Femoral artery. Answer C. Rationale. The brachial artery is commonly used for blood pressure measurements. 13. The first step in performing any procedure is to A. Gather supplies. B. Explain the procedure to the patient. C. Wash hands. D. Put on gloves. Answer C. Rationale. Hand hygiene is the first step to prevent infection. 14. Which of the following is not a vital sign? A. Blood pressure. B. Pulse. C. Oxygen level. D. Urine output. Answer D. Rationale. Urine output is not considered a standard vital sign. 15. To prevent dehydration, a CNA should A. Restrict fluids. B. Encourage fluid intake as allowed. C. Limit fluid intake to meal times. D. Monitor output only. Answer B. Rationale. Encouraging fluid intake helps prevent dehydration. 16. A CNA can help a resident maintain independence by A. Doing everything for them. B. Offering only necessary assistance. C. Restricting activities. D. Avoiding patient interaction. Answer B. Rationale. Offering only necessary assistance promotes independence. 17. A nosocomial infection is A. A chronic infection. B. An infection caused by bacteria. C. An infection acquired in a hospital. D. An infection spread by family members. Answer C. Rationale. Nosocomial infections are those acquired in healthcare settings. When providing care to a patient who has dementia, the CNA should A. Use complex instructions. B. Speak slowly and calmly. C. Ignore repeated questions. D. Avoid making eye contact. Answer B. Rationale. Speaking slowly and calmly helps patients with dementia understand instructions. 19. When should gloves be changed? A. After every patient contact. B. Once every shift. C. Only when visibly soiled. D. Every 2 hours. Answer A. Rationale. Gloves should be changed after every patient contact to prevent cross-contamination. 20. A patient has right-sided weakness. Where should the CNA place the wheelchair when assisting with a transfer? A. In front of the patient. B. On the left side. C. On the right side. D. Behind the patient. Answer B. Rationale. Placing the wheelchair on the stronger side facilitates a safer transfer. 21. When a patient has an indwelling catheter, the bag should be A. Below the bladder level. B. At the level of the bladder. C. Above the bladder level. D. Disconnected when moving. Answer A. Rationale. Keeping the bag below the bladder prevents backflow and reduces infection risk. 22. The CNA notices a resident's hearing aid isn't working. The CNA should A. Turn up the volume. B. Change the batteries. C. Ignore the issue. D. Report the problem to the nurse. Answer D. Rationale. Reporting device malfunctions to the nurse ensures proper follow-up. 23. Which of the following is an example of neglect? A. Feeding a resident with difficulty. B. Ignoring a resident's request for help. C. Answering call lights promptly. D. Providing perineal care daily. Answer B. Rationale. Ignoring a resident's requests or needs constitutes neglect. 24. A CNA overhears a nurse discussing a patient's diagnosis in the hallway. This violates A. OSHA guidelines. B. HIPAA guidelines. C. Medicare regulations. D. CNA scope of practice. Answer B. Rationale. HIPAA protects patient privacy and confidentiality. 25. When shaving a patient, the CNA should A. Shave in the opposite direction of hair growth. B. Use long, quick strokes. C. Shave in the direction of hair growth. D. Shave dry without shaving cream. Answer C. Rationale. Shaving in the direction of hair growth prevents skin irritation and cuts. 26. To prevent aspiration during oral care for an unconscious patient, the CNA should A. Use a toothbrush and rinse. B. Place the patient in a side-lying position. C. Sit the patient upright. D. Avoid cleaning the mouth. Answer B. Rationale. Side-lying helps prevent fluid from entering the lungs. 27. Which of the following is an example of objective data? A. The patient feels nauseous. B. The patient has a temperature of 101 degrees Fahrenheit. C. The patient seems sad. D. The patient says they have pain. Answer B. Rationale. Objective data are measurable. A temperature reading is objective. 28. To help prevent falls, a CNA should A. Keep the bed in its lowest position. B. Raise the bedside rails on both sides. C. Keep the bed in its highest position. D. Encourage bed mobility only. Answer A. Rationale. Keeping the bed low reduces the risk of injury from falls. 29. Which of these actions is an example of good body mechanics? A. Reaching as far as possible to grab an item. B. Keeping items close to your body when lifting. C. Using only back muscles to lift. D. Twisting your spine to move an object. Answer B. Rationale. Holding items close to your body helps maintain proper alignment and reduces strain. 30. A CNA finds a patient unresponsive. The CNA's first action should be to A. Call for help. B. Begin chest compressions. C. Check for a pulse. D. Place the patient in recovery position. Answer A. Rationale. Calling for help ensures that additional support arrives quickly.
Thank you for watching. I hope these CNA practice questions helped you feel more confident in your studies. Please don't forget to like, subscribe, and hit the bell icon for more helpful content. Keep practicing and good luck with your nursing journey.